Yeah, welcome to you people once again for the part two of this video, difference between menstruation and ovulation. Yeah, as we all know, ovulation takes place an average about 2 weeks before your period. I repeat, ovulation takes place an average about 2 weeks before your period. All through it can varies from 10 to 16 days before the onset of menstruation. Depending on the length of your period, depending on the length of your period, phase based on this guideline, many women are taught to expect ovulation around 14 days of their menstruation cycle. Now, listen. I'm coming again to repeat this again for us to understand what I mean. Ovulation, someone inboxed me last week was asking me, is it always 14 days from ovulation to period? Now listen. Ovulation takes place an average about 2 weeks before your next or before your period. Although it can vary from 10 to 16 days before your onset of your menstruation, depending depending on the length of your period or the length of your lat. Based on the guideline, you might have many women out there, or you that is watching me, taught to expect ovulation around 14 days of their menstruation cycle. Now listen, you ask yourself how many or long after menstruation does ovulation occur? What are the lengths of your average cycle? That's the most important thing. Work out the length of your average menstrual cycle. Day one, right? Day one is the first day of your menstruation. You get to your calendar. Day one, you write it, circle it. Day one is the first day of your menstrual cycle, period. And the last day, you also circle it, is the day before the next period. You circle the first day, you circle the last day, which is the 4 day cycle or the 5 days menstruation. Some people ovulate 4 days, some people ovulate 3 to 4 days, some people ovulate 6 days. Depends on your own length. Your question should be, what happened? Ovulation happens about 2 weeks before the next period, expected period. So if your average menstruation cycle is 28 days, your ovulation should be around 14 days, or should be a day 14, there about 14 days or a day 14. Now listen, the average person menstrual cycle is between 28 days to 32 days cycle. Their period than typical lasts from 3 to 7. From 3 to 7 days. Someone might be asking, getting confused this side. There's nothing confusing there. The average person menstruation or menstrual cycle is between 28 days to 32 days. In the menstrual cycle usually happen in the phase of occur that's before ovulation. In this area, that is when they pick up when you have about issue that has to do with hormonal imbalance that related with prolactin, estrogen. These are the areas where they can be. That is when if you go to a labs, they ask you when are you menstruation, come to the second day of your menstruation, come to the third day of your menstruation, come to the first day of your menstruation. That is something they pick to dictate what actually is the problem it's all about. There are many people I send drugs to across the country, across the state, across the different kinds of places or within the state. I am still Dr. Kevin, the owner of the Medical Solution in WhatsApp, and also in Facebook. Try as much as possible to follow up. You will learn more. These are the parts of drugs I do send across. Inside these drugs, someone might try to know the meaning or the work of these drugs. You will go to market, you get it, but the issue getting it is never my concern. You will get it there, fine. But there are foundation of drugs. There are things you need to do before taking this. If I should open this, this come in a white plane, this come in a yellow cup. There are different drugs that works different kinds of. These are the two drugs. But this of the yellow cup, if you watch this inside, if you can come closer, watch it very well. The color is different from that of the white one. Check this. I'm not here to market any drugs. I'm not here to plead anyone to buy. No. Infertility is not something you slide back and watch yourself. These are the measurement drugs when a woman is talking about issue of fibroid. But the most important thing any doctor will ask you to find out the cause of those fibroids, because the reason why some people, after going under surgery, after performing all kinds of uprooting those fibroids, a year, 2 years, it is still come back. It's a growth. Unlike some trees, if you cut it, sometimes it will also germinate again. Now, these drugs is everywhere you can get. I'm sure of this white one, you can get it anywhere. But I can assure you this yellow one, you can never. It's not done anywhere. So I want to buy this particular drugs. I'm not selling it. I can't sell only these drugs to any given person, because I'm not going to sell it because it's kind of cheating. I'm cheating you because it's not going to give you a result without having a a grand treatment that will stabilize your system. In other words, for you to gain balance, for you to know the reason, for you to know the secrets behind some issues that you are having. Months, 3 months, 4 months, 5 months, 6 months, a year, 2 years, we are still suffering from menstrual cycle issue, from menstrual disorder, from menstruation issue, from ovulation issues, all because of this. Some people don't know how to calculate themselves. Some people knows how to calculate themselves. But the issue there is this: their ovulation is not active. All those things are a result of some infection. All those things might be result of hormonal imbalance, which need a little minor treatment to treat. Some of them, you are treating yourself for hormonal issue, and you're having a sexual intercourse with your husband. How do you expect such to work? That's the question I'm asking everyone. Some still ask, what is the reason? Why is it that after taking all the kinds of drugs, all the kind of medical drugs, nothing is happening? You are the cause of it. If you don't know. One, first check the kind of doctor you operate with. If he's following you basically, gradually, some people outside the country will call on phone and ask, the drugs is working perfectly. Why is it that the fibroid is going down there? These drugs are not herbal. I don't deal with herbal. It's not a herbal medicine. It's a medical. We give some people bills. You go to a WhatsApp, you go to a Facebook, there are many testimonies going on there. People bills, they will ask how, why. When you pack the drugs and send across to them, they'll be like, what is happening? Is it a magic or not? It's never a magic, all because of what? Drugs has stages by stages. What is this? What is it? Some people will like, I am menstruating. My menstruation is supposed to stop today or supposed to stop 2 days ago, but yet there is no way of it. It's not coming close to stop. What am I going to do? What am I going to have? The reason is because your doctor might not be marking or might not be following you up to know the color, how is it, if it's flowing well or not. Someone that having a shortage of blood, how do you expect yourself to menstruate? Someone that having a problem of hormonal imbalance, or someone that is having a problem of a staph infection, irregular menstruation. It flows this week, it will not flow next week. If it start flowing, it flows more than 4 days, it flows more than 5 days. That is not that is a big problem. You need to work towards it. Working towards it doesn't mean that you are going to stick on one particular injection. Stick on one. There is some injection that you are not supposed to use. There is some injection you are supposed to convert or to time when to use it or when not to use it or how to apply on it. The other of my Facebook page, someone was saying that I use Rosofin injection. Yeah, Rosofin is a powerful injection. Yeah, I can relate to you. It's a powerful injection. But your question is it sensitive to the medic? Is it sensitive to your illness? Is it sensitive to your health? Is it sensitive to you that your particular problem that you're having? But some people will be there. I apply this self-medication is totally bad. Go to any nearby your doctor, any gynecologist that can follow you up from the beginning to the end. If you are having a problem of if you're having a problem that has to do with menstruation, you expect your man as well to be perfectly okay down the sperm. No, there's an error that needs to be tackled. So please, no matter how, try as much as possible to know when and how to go on some certain medications. Calculate your menstruation. There are drugs that are required when to use. For example, Clomid are mainly used from the second of your menstruation to 8 days. Some take it anytime, anywhere. I was surprised someone was telling me that she's taking folic acid 3 times daily. I was like, are you normal? It's just that the grace of God is just with you. If not, I've been taking Clomid like ten packs ever since this year. I said, oh, this year is just yesterday. What is happening? The rates of infertility in this country, outside the country, are becoming unbearable. We medicals should look down, deep down, to know the roots of what many are suffering. Some people are using all kinds of medication to transform their monthly cycle to something else. Your body system doesn't require some alcohol. Your body system doesn't require some acidic, your body system doesn't require some pills you are taking. Rather, you're taking some pills. In other words, to stabilize or to stabilize your system for you not to get pregnant. Some people take some drugs, some pills, contraceptive pills, to delay their menstruation. You have never given birth, you're never impregnant, you're never married, but you are taking your destiny by your hands. You are using your hands to take your destiny, which is very wrong. It's not advisable, please. It's not advisable. You take prosmotun after sex, you drink beer. You take a white quinine after sex, you drink beer. You take Sprite, you take this, you take all kinds of. There are numerous of them they do take. All those things will not help. Rather, it will affect you. All those things can start from your menstruation. For your information, please, before your menstruation will be tampered, will be harmed. Before your menstruation will be harmed, please be rest assured that your ovulation has been already harmed. You wake up to realize that your menstruation is no longer functioning, but you never realize your ovulation has problem. Your ovulation must have had problem like months or years back. But when you notice what is happening, it's when your menstruation start misbehaving. You now realize you can't treat that menstruation without boosting your ovulation. It's an error. Check. Thank you.